Hey, I'm Dr. Bridger Cox. I'm a neurosurgeon in Oklahoma City. I've been here for about 10 years. I did my residency at the University of Florida. I also did a complex spine fellowship there. And my practice is primarily complex spine. I do a lot of scoliosis, a lot of revision work. You know, NanoHive is a company that I got involved with a few years ago, and when I saw some of their technology, and primarily, originally it was the ALIF graft that kind of caught my eye. These cages they don't have quite the stiffness that the kind of slab of titanium or the block of titanium that I think, I've seen in some different grafts has, and it's this more soft titanium lattice that makes it more comparable to the properties of PEEK, but you get that interaction with titanium and bone, which is such a great conduit, but then also again with the lattice, there's really so much room for bony ingrowth, which I think is really what kind of sets this graft apart. Because it's 3D printed and because it is so porous, you don't have just the CT images where you're just looking at a block of titanium and it's so hard to actually see bony ingrowth. There's good size apertures inside the graft, and then also just the porous technology that it's pretty easy to assess on a CT scan later on, whether a patient is fused or not. Depending on the biologic you're using, that can be used with that port to directly pack inside the graft, and you really get this robust kind of bony interface with that lattice structure. So the last few years when I've been using these grafts, we ended up doing a retrospective look, and this was patients from October of 2021 to November of 2023. These were 60 total patients. Ended up being a total of 103 surgical levels. Mostly one level cases. The majority of these cases involved L5-S1. That's kind of my own bias, and I feel like an ALIF is such a great operation at that level. And then following these with x-rays, at least out to kind of the 6-month mark with, 3 or 4 visits, over that first 6 months post-operatively. There's been, I think, a real improvement, not only just in the, the feel and everything of how these are implanted, but also just the time it takes to reliably get a fusion and have stability. The instruments that come with this set are very straightforward. I'd previously used allograft and standalone PEEK cages. I'd moved somewhat to titanium coated PEEK. The ability for bone graft to incorporate in and around the graft. The imaging characteristics later, I found are superior to the other titanium cages that I've tried. We got all 60 of these patients out to at least 6 months and have consistently seen solid bridging bone on the patients that ended up with 6-month CTs. If you look at this ALIF patient number 1, that's a 58-year-old male, underwent an L4-S1 ALIF, 6-month post-operative CT scan, and you can see in the images there's pretty clear bone growth with in-plate to in-plate contact. There's no lucency or haloing around the graft. But again, you can kind of see on these images that there's good solid fixation, and that's just at 6 months. ALIF patient number 2 is a 54-year-old male, had a 2-level L4-S1 ALIF. This is a 6-month post-op scan, and again, demonstrates solid fusion with bridging bone through the interspace. You can really see on both the sagittal and coronal images that there's good bridging bone, really in-plate to in-plate, with no lucency or any other kind of concerning features. ALIF patient number 3, 56-year-old female. This is just a 1-level L5-S1 ALIF, 6-month post-operative scan, good solid fusion. Again, you can see in and around the graft. Again, confidently assess this, that you can really see, that bone is growing where you want it to. Finally, the ALIF patient number 4 is a 63-year-old female. This is another L5-S1 ALIF. This is a 6-month post-op CT scan and solid fusion in and around the graft. Screws are all in good position, and this is again, a solid construct at this point that I would typically release this patient back to full duty. To go over the cervical system just a little bit, we did look back at our experience with this, and this ranged from October of 21 to May of 23. There were 113 total patients with 210 surgical levels. You can see ACDF patient number 1 a 45-year-old male. This is a C5 to 7 ACDF. This is a 6-month postoperative CT scan. Again, you can see good solid fusion in the grafts. I typically use the standard anterior cervical plate with 2 screws in each vertebral body. And you can see again the grafts in between with good bridging bone in both the sagittal and coronal images. ACDF patient number 2. It's a 66-year-old female with a C4 to 7 ACDF. This is an 8-month postoperative scan. And again, you can see good solid fusion, no haloing or lucency of the graft or the plate and screws, good bridging bone in and around the graft, especially on the coronal images there where you can see there is some bridging bone already lateral to the graft. And I wanted to move away from PEEK. I wanted to move to something more titanium because I really like that interface between titanium and bone. And then also, again, with the imaging characteristics, the porosity of the graft. There's just a lot of advantages to this when I compare it to other grafts or cages that I've tried before. Now I have about a 3+ year experience with these and plan to continue using them.